Yes, absolutely. Thank you very much, Dr. Bronstein, for having me here and for allowing me to mentor your students during the spring 2017 semester. So I am a full-time employee and graduate student at the UT Health School of Public Health, Brownsville Regional Campus. So Brownsville is down at the U.S.-Mexico border. It's the farthest tip in Texas. I've been there for about 3 years, and I've been working in health informatics for about 4 years. So I graduated from the UT Austin Health Informatics program. They have a certificate program in Austin before coming to this job. And I work with our local regional health information exchange, the Rio Grande Valley Health Information Exchange, to connect the clinics and hospitals in the region, and also work on an initiative called Project Diabetes and Obesity Control, which is a project from the UT system to basically integrate data from data sources other than electronic health records so that we can bring care to outside of the clinic, outside the four walls of the clinic, right? So. Absolutely. So I proposed. So I'm really interested in this concept of bringing data outside of the clinical environment to the clinical environment. So the project I proposed was to take.
Let me stop you.
Go for it.
So earlier in the course, I introduced them to the term real-world data.
Ah, real-world data.
Which
okay,
is apparently
perfect.
the new term for this. So
okay, great.
You might
reference that. Yeah.
They've heard this term. And this. Okay, so let's do that.
Okay, perfect.
Should I ask the question?
No, you're okay. You can just start.
Yeah. So can you prompt me again? Sorry, it's
difficult. Asking what the project.
What was the project? Why is it important?
So I'm very interested in the concept of real-world data and bringing in real-world data into the clinical environment so that practitioners and patients too can be empowered with this data to make decisions about their health. So I'm specifically interested in the nutrition domain. So the project I proposed was to create a FHIR application to visualize results from a nutrition algorithm that takes components from purchases. It takes the physical items that were purchased from a grocery store, scores them from 0 to 100, and comes up with an aggregate score. So displaying that alongside of data from electronic health records for providers and for patients. Right, exactly, yeah. So it's an approximation of their eating habits. So there's another algorithm out there called the Healthy Eating Index, and that can be used to identify the nutrient quality of the food supply or of an individual's diet, and it's always approximating their diet, right? It's never actually, you never know if what they bought is what they're actually going to consume, but you can come close to assume that if this is the food that's in their house, that's their food supply, that's probably what they're going to be eating. And also it's probably closely correlated with the personal choices they make, right? If they buy vegetables from the grocery store, they're probably eating healthy outside of the grocery environment. But if they buy just meat and sugar, that's probably what they're eating outside of the grocery store as well. But there's some studies. I think there was a study in 2012 that sampled. I think it was a smaller area, but they identified 60-80% of people's food consumption comes from the grocery store and convenience stores. So we can make a pretty sure assumption that the food that people are buying are what they're eating. Yeah, absolutely. So there are a few nutrition algorithms that currently exist. There's definitely a need for additional nutrition algorithms. The one that I mentioned, the Healthy Eating Index, is actually far away from being implementable in a real world setting to actually use the data from purchases to approximate a healthy eating index score. So there are a few. So Healthy Eating Index is one. There's also a front of package labeling system called NuVal, which was developed by faculty at the Yale School of Public Health, and they don't allow you actually to aggregate the scores from the individual products that are purchased. And then a third that we decided to use for our project is NutriSavings. So they claim 85% market share in the U.S. And one of their clients is Walmart, or one of their partners is Walmart. So that probably accounts for most of the 85% market share. So what NutriSavings does is they they work with employer-based insurance programs to score people's purchases, the covered participants' purchases, and they provide that information to the covered entity and also to the consumers. So we worked with them to get a sample data spec and built sample data to populate our application. So we were the goals of the semester were to basically create a mock application that demonstrates the ability to combine these two data sources, right? Electronic health records and the purchasing data, so nutrition algorithms, in hopes that grocery stores will see the potential of use of this real world data, and would be more willing to share their data. That's one thing that NutriSavings is kind of crippled with right now, is that, and I've actually personally asked some retailers, but they're reluctant to share their data outside of the four walls of their facilities. But we can look at the application now. I think it'd be good to show you the back end of our system and how we imagine a clinic working with a local grocery store to enable this application. So in this diagram, it's a bit complicated, but I hope I can talk through it well. So we have data providers on the left. These are electronic health records who are in the area, and or these are clinics that have electronic health records. And then we have a grocery store partner and an imagined interchange or some database that can take in the data from the electronic health records and from grocery stores. Ideally, this would be a FHIR compliant server that has some other storage means for the grocery data, or even I guess the software application could query NutriSavings and get the data in real time. So the interchange is we basically designed this for a local model. We have a partner that is providing us with an interchange. So we wanted to implement this project after the spring. So this is why we have it in this way. And then we have Georgia Institute of Technology here designing the front-end applications that would query our FHIR compliant server. So here we would have, if a clinic is interested in becoming involved, we would, to get an absolute match and to not have to use a patient matching algorithm, which we could absolutely use, we would have the provider give the patient a NutriSavings calls it an employee ID, because they usually work with employer-based insurance programs to track the patient. And typically, NutriSavings works with rewards cards to track people across grocery stores. And the participant would take the rewards card to the grocery store and scan it at a participating grocery store, which would identify them across the electronic health record and with a grocery store, and would allow the data to be shared with NutriSavings. And NutriSavings currently generates three types of data. So they can provide a trip score for individual grocery trips, items received at those trips, and then also a monthly summary for that participant. So we thought it would be good to allow the provider to see all these different types of granularity, but also see a monthly score at the high level. So I'll show you the front end application now. So the front end application, we have Jane Smith here. We decided to make this as simple as possible for this could be a registered dietitian or a provider. During our spring project, we interviewed two registered dietitians and two MDs for the project, and then we also had some consultation from a consulting firm, and so this just basically shows a tiled view of different relevant clinical items from FHIR resources from the EMR. So we have like respiratory rate, hemoglobin A1C, glucose, HDL, LDL, BMI, and then the actual nutrition score. We could integrate additional metrics as needed, but these were some that the registered dietitian thought were important for her practice. So we have a high level view here where the provider can see all of these different tiles, and if they click into one, we're clicking into the nutrition score. They get a graph view that shows the monthly summary for the patient over time, and if the provider were to click into any of these month points, they could see the trip summaries over time as well. So this was a very simple tool. We wanted to do a minimal viable product, but some things that we think could be incorporated are like a notes function, a goal setting function. Unfortunately, with this, we don't have a very high level of granularity. We're only seeing the monthly score, right, and the individual scores. This nutrition index is it just shows the nutrient density of different items purchased, right? It doesn't actually show like somebody, for example, somebody could just buy apples for an entire month and their score would be 100, right? The scale is from 1 to 100. But just eating apples is not enough to fulfill all of your nutritional requirements. So I think there's a huge need to get more granular data from grocery stores. And actually, like working with NutriSavings, they weren't able to share that granular data. They're only able to share these nutrition scores, these aggregate nutrition scores. So I think it's absolutely necessary that we get more granular data, both so that we can develop additional algorithms that are more granular, and so that we could actually provide like clinical decision support. I think I love the CDS hooks initiative that's going on right now. I think it'd be great if we could build some CDS hooks that are relevant to nutrition, and but we need access to that granular data. So I'm hoping that as we build more of these applications, we can use this to show grocery stores that we are that there's utility for this data, and hoping that if we build it, they'll come and they'll give it to us. So I think that's a good overview of the software application.